Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. It is Friday, August 21st, and I am here with Dr. Stuart Kennedy, Incident Manager, for our response. It's been a while, Dr. Kennedy. We haven't sat at this table together for about a month.
You know, Tracy, and I've missed you.
Of course.
And it's you know what? It's great to be back. We both took a bit of a break, and we're ready to go.
Refreshed.
You bet.
Absolutely, that's important
Okay.
because we continue to have no COVID-19 positive patients in our hospital right now. As of yesterday, there was one active case in our community. What's your confidence level at?
Yeah, great news. And we haven't had a case in the hospital for, I believe, over a month. And so certainly, as we always said, there will be COVID-19 that creeps into the community. As of last night, I believe we had one active case, but certainly the health unit's dealing with that case. So I think we're confident. We are always concerned about, the crossing the border, going to the United States. Right now, you know that the border's been closed, but there's still people, because of business, because of families, can go across the border to the United States. But they're still exploding there, and certainly if you can avoid going across the border at all costs, please avoid going across the border because you put the whole community at risk when you return.
Absolutely. We've had a lot of diligence in the community, so we need to keep that up and considering really how important it might be to stay at home versus crossing the border right now.
But the community is doing marvelous. And over the summer months, wow, we have not had a great number of active cases. People have been traveling outside of northwestern Ontario, but I believe our community is following the rules, and that's really appreciative, and I thank the community for that.
So, as people are preparing right now to go back to school or have their children back in school, people are a little bit nervous. What is your advice for them?
Well, I'm nervous too, but we need to resume normal activities with caution. COVID-19 is going to be in the world, in the nation, in our community for a number of years to come. We can't run away from COVID-19. We have to learn to live in the midst of COVID-19. So I feel for the teachers. I feel for the parents. I have two grandkids. One's going to go to school in the fall in Toronto, and my daughter asked me whether she should send her, and I said, do what you're comfortable with, but you have to work. Your husband has to work. I feel the school, there will have some risk involved, but you also have to use your common sense. I mean, you really have to make sure that you're washing your hands, teaching your children to wash your hands, making sure you keep your physical distance as best you can. But we know right now Toronto is doing well as far as disease. Certainly Thunder Bay is doing excellent. So you have to look at the prevalence of the disease in the community. And then you have to judge that risk. And only you can judge that risk. But you can't do it out of fear. You got to do it out of education. So inform yourself how much potential exposure is going to be, and take those special precautions. If the child has a cough or cold or any symptoms, you know to keep them home. And what I'm also concerned about is I feel for both the employers as well as the parents, because I know they may get called in the morning or the afternoon that the child has a bit of a sore throat or sort of a runny nose. They have to leave the place of work, go pick up their child, and bring them home. That's a disruption both for the family. It's also a disruption for the employee, especially if it's such a work employee. So I think as managers, we have to be flexible as sort of a community to be understanding that children are going to have a higher absentee rate, and it's going to have an impact on the employee at different organizations. So I just plead to the managers, plead to the community to be understanding when you can regarding the absentees of children, and the parents have to go return as caregivers.
That's really great advice, and it's a difficult and nerve-wracking time for parents right now. So, we certainly understand that, and we're here to support people.
And even for employees here at the hospital. I mean, we have employees that will have to go, but they also have a critical service at the hospital. So we need to, as a manager in the hospital, take that sort of advice and make sure we're as flexible as we can be, but still provide the care for the patients here.
So that ties into my next question, because there are varying opinions across the world on whether or not there will be a second wave, and if there is, what it might look like. What is our hospital doing in terms of planning for a possible second wave?
Well, I'm going to take the bold prediction here that because of our isolation in northwestern Ontario, and as long as our sort of patient population, our population of the Bay, continues to follow public health advice, which they have been doing, we will get an increase in cases, but I'm still confident that we're going to avoid sort of a significant second wave that is going to make us go to the drastic steps we had for the first wave, canceling all elective surgery, as you know, canceling all diagnostics. We cannot go backwards. But we have met as a recovery team, we have met as a senior team, and we are putting initiatives in place in case we need to take those drastic steps. I can predict we will not go back as far as we went last time, but will be a graduated rollback once certain triggers are reached in the community. And we have those triggers identified. If we get more than 7 patients here at Thunder Regional Hospital, that's a trigger that we need to actually cut back and prepare for other sort of COVID-19 challenges in the hospital. So we have to look at our human resources, and we also have to look at our communication strategy, and then we have to look at our surge capacity. We've done a great deal right now. I mean, we're only at 90% capacity right now, and we're at almost 100% return to service, almost. So I think we have a great plan. That plan, as everybody says, somewhat with frustration, is always changing, but at least we're adaptable and we make it work for the patients of Thunder Bay.
And it's important to take a look back at where we've been and what we might possibly be facing and identify any possible areas for improvement.
Yeah. I think what we may have to look for is sort of an influx of people wanting to move to Thunder Bay because how well we've done. So employers, get ready. We may have some opportunity here because Thunder Bay has done quite well through this whole process.
That would be nice. I actually know of a couple who did that exact same thing.
Oh.
Moved here from Toronto.
Great.
Yes. So our COVID-19 assessment center here has been pretty darn busy lately. Now, we assumed responsibility for booking COVID-19 test appointments recently. How are things going?
Well, they certainly have been overwhelmed. I think initially they were getting 200 calls a day at the public health unit, and we don't know why, but we're getting about 1,000 calls a day. And it probably is with the anxiety of school starting, the anxiety of business returning, travel. We had the fire problems up in the north, and people had to be evacuated, so they all had to be sort of tested. So a lot of calls. The staff, short-staffed, have done outstanding work, and but they certainly have been overwhelmed. So they're very, very busy. Certainly, as of yesterday, the average wait for a call to the assessment center is only about 7 minutes. I know 7 minutes is a long time in some areas, but 7 minutes is not too bad given 1,000 calls. I wouldn't sort of call first thing in the morning. I'd call in the afternoon to arrange any type of appointments. And now we have an online available, which is great. And certainly the website is tbrhsc.com and then .net, and then it will sort of direct you to the assessment center to make that appointment. So I think we're making some good progress. And drive-throughs. You know, we're going to sort of, if we get much of a backlog, we'll offer drive-throughs that we can do more expediently. And I think we have to look at other areas within the assessment center, or outside the assessment center, to do more testing. We have to sort of begin to engage, I think, primary care, and we're looking at that to see if there's other partners that can help with doing the testing too.
Well, that'll be great for the community members too. It'd be a little bit more convenient for them. Okay, so a key message from that, go online to book your test, tbrhsc.net.
But Tracie, I want to point out, you know, in your notes to me, you did say tbrhss.com. So I just want to make sure that you realize that.
So I did.
Okay.
Good catch.
I just want to make sure of that, Tracie.
Guilty as charged. Good thing I was awake at least. So there's been a lot of talk in the last couple of days about whether or not face shields are appropriate, and if a patient will be turned away if they're not wearing a mask here at our hospital. Can you clarify?
Yes, no patient who requires medical attention will be turned away at this hospital if they do not are unable to wear a face mask. But we need to protect all staff and patients in this hospital. And so if it's not an urgent test or an urgent procedure, the screeners will call up to the appropriate medical department and decide how urgent the test is. If it's not urgent, that it will be rebooked. And then the individual can come back at a time that is a safer time to come back toward less exposure. Face masks are the best protection of spreading the virus to somebody else, as well as a 2-meter distance. The shield provides some protection, but do not protect against the droplet sort of contamination to others. The health unit's recommendations: if you're going to wear a face shield, you also need a face mask. So the two in combination are good. Just a face shield is not. But we understand there are very, very rare, limited medical conditions that some people cannot wear a face mask. Not many, and certainly very, very infrequent. So certainly, but there will be the occasional one that will be unable to. We appreciate that, and we'll make accommodations for that individual to make sure they get their testing done.
So who would be involved in a decision like that if someone presented and couldn't or wouldn't wear a mask and there's a call to the unit? Who's involved in deciding whether or not the appointment or the care is urgent?
So certainly it's a medical decision, okay, and it's based on the urgency of the test. And when we order tests, we order the test, priority 1, 2, or 3, or 4. Okay, so it's a 4. It can wait. 1, 2, or 3 will be completed, and will be respected, and then they will take extra precautions when that patient comes in. If it's a 4, they can be rescheduled at different time, and the medical doctor or who ordered the test, or the nurse practitioner, the professional, will be informed about the cancellation and the rebooking.
Okay, great. Thank you for clarifying that. Now, we have some volunteers who are back with us. We've certainly missed our volunteers. And given the current environment, we have a brand new role for volunteers. And these are called wayfinding volunteers. How are they helping?
Oh, we love to see the volunteers. They always have a smile. I mean, these individuals give up their time to come to our hospital to give their service for the benefit of the patient. And I believe they missed us just as much as we missed them, because they just bring a positive energy. But we had to take that difficult decision not to have them because we don't want them exposed to the COVID-19 during the unknown environment. Now we're doing pretty well. We only, as you said, as of last night, just 1 active case, and we've done well, taken all our precautions. So they're ready to get back in here and want to get back in here. But they're there to actually deliver personal patients' items to the rooms and to the nursing stations. Transport our outpatients within the hospital, because we still don't want patients traveling throughout the hospitals sort of supervised or without somebody watching where they're going to find out they're not going down too many wrong corridors, exposing other people to potential contamination. They provide direction and information. They collect and clean wheelchairs, and we just can't thank them enough. And we'll have more roles as time goes on, after we get more comfortable with the environment. But still, we need to limit the traffic in this hospital, and that's why we still only have essential care partners and care partners. We're looking at those policies all the time, but still, all the infectious disease protocols outline that the more minimal exposure you have to people around you, the less the infection will spread. Not just COVID-19. There's other infections in the hospital. The hospital's a dirty place to be as far as infection disease. We keep it as clean as we can, but certainly there are a lot of what we call infections that erupt in the hospital.
Yeah, and it is so great to have volunteers back with us, helping to contain that risk and meet those patient needs at the same time. Looking forward to seeing more of them back. Thanks so much. We'll see you again soon.
Thank you.